This is Dr. Cyrus Sebastian. This is my fourth video from the Couch series. I'm a consultant psychiatrist, and in this video, I'm going to talk about the mental health effects on staff, in particular, frontline NHS staff, because of the coronavirus COVID crisis. So, first of all, I'm going to talk about moral trauma and how this is something that could impact the well-being of our frontline staff. And the term moral trauma originated from the military, and it's basically psychological distress due to violating one's moral and ethical code. In medicine, we have quite strict moral codes regarding how we practice, regarding what we do. Every life matters. We have to do our best using whatever resources we have to save every person and make them better. Now, during the period of crisis such as this pandemic, frontline staff are forced to make some really difficult, even impossible decisions. There's not only a lot of stress and extreme pressure whereby they're working under, they have to make the most of inadequate or constrained resources. And they have to make decisions regarding which patient gets a ventilator, for example, and whether they should stop ventilating someone and letting them die. On top of that, there's been a lot in the news regarding PPEs, personal protective equipment, and there is a shortage of these. And a lot of health staff that I've spoken with, they're genuinely scared. I mean, they're fearful. They're worried about catching this virus, getting COVID, and then passing this on to their families, relatives, loved ones, and they have to balance that versus the healthcare and the need that the patients have and the duty of care towards the patients. The effects of these dilemmas, these sort of moral trauma, could be immediate. Staff could suffer from acute stress reaction or shock as a result of this. And basically, this is extreme distress. They may immediately stop functioning, stop working. They may be in this dazed state whereby they could become disorientated. They may stop thinking logically, planning, and it could seriously compromise their functionality at work. Another effect of this traumatic work environment is fear and anger. Now, some fear is understandable, fear regarding one's own safety and the safety of our family. And anger also, to small degrees, understandable. However, if we are fearful, angry all the time, then we can't function. And this would have severe implications on how we can function at work. Some of us, we have underlying health conditions and are categorized as vulnerable staff. And we have to factor that in, the fact that we are more vulnerable to catching COVID. Generalized anxiety symptoms will be common, and the worry that I have is that this could develop into generalized anxiety disorder, whereby the individual is anxious all the time to the degree, once again, that they cannot function properly. Adjustment disorders is another psychiatric condition that could affect them more in the intermediate term. And it's the acute stress and the shock and trauma could mean that for several weeks, even months, they're out of action because of depression or anxiety. Another more longer term manifestation of what's happening right now among staff would be post-traumatic stress disorder. And a lot of studies have looked at past disasters and traumatic events. And the manifestations could be 3 to 6 months down the line. Now, solutions here. One solution is that we need to monitor our own mental health. So all frontline staff need to sort of constantly reflect on what their mental health is and how they're working and how they're thinking, whether they're really angry, whether they're fearful, and they need to watch out, not just for themselves, but also the colleagues that they work with. And also, one function of ward managers and particularly line managers and it's important to look after the mental well-being of your staff. And if someone presents with shock or acute stress reaction, psychological first aid may be required. And I have summarized some of the components of psychological first aid at the bottom of my video clip. However, it includes talking to people, engaging them, providing safety and comfort, which could be just time out. Just you've been in this unit for too long. You need to go out, get some fresh air. It may be that they haven't eaten. It may be that they're dehydrated, so they need some water. So these kind of practical measures that needs to be applied. And some of the concerns that staff may have is that they're not sleeping well enough, or they have ill relatives that they're worried about. The most important one, however, it seems that it's the PPEs, personal protective equipment, and it's important that our frontline staff are adequately resourced with that. Other type of support include apps. All NHS staff are entitled to use HeadSpace application for free, and also they can be signposted to local counselling services, and a lot of charities and organisations are providing free or subsidised counselling online. And finally, I'm going to talk about peer support programs, which I think is an important and even essential addition to our work environment. In psychiatry, our trainees have had balanced groups for many years, and basically trainees come together in a confidential space for 1 hour a week, and they talk about anything that they wish to reflect on, anything that's bothered them, interaction with their patients, with staff. And the idea is that you share the responsibility with others. And it's very powerful to talk about these really personal issues in groups. And then you feel that you're heard, and people can respond to you. And this way you feel supported, and you get the strength to carry on doing a very difficult job. And the sort of acute hospital equivalent of this is called Schwartz Rounds. And it could be ward-based, where all the staff in that ward, doctors, nurses, physiotherapists, they get together for an hour once a month, and it could be once a week. And again, talk about these really difficult issues, these really pertinent sort of moral traumas and moral decisions that has caused them psychological distress, the belief that they're violating their moral and ethical code. And ultimately, it is a very useful way for individuals to feel supported and for them to support each other.